6:44 right now. June is Acne Awareness Month, and although there's a good chance that you've dealt with it at some point, experts say most of us could find more information about acne helpful. And joining us now with her insights is Dr. Glynis Ablon of the Ablon Skin and Research Institute. Dr. Ablon, great to see you again. Good morning.
Good to see you too.
All right, so acne is the most common skin condition in the entire U.S. It can pop up at any point in our lives. I actually just had a little spot here right below my eyebrow. Can you start off by talking about some of the reasons why it happens and when you know it's time to get professional help?
Yeah, so acne vulgaris actually represents a common inflammatory condition of the pilosebaceous areas, and it's especially seen in adolescents and young adults. But as you mentioned, different forms of acne can continue into the older decades. But the etiology is multifactorial, and it includes an increase in sebum production, bacterial overgrowth, sticky cells where the cells don't turn over as they should, and then, of course, hormones, which as parents, most of us find very difficult to treat.
Yeah. All right, so there are a lot of treatments out there and some exciting breakthroughs. Can you talk to us about something called liquid gold or the liquid gold? I'm intrigued.
Yeah, Sebacea. It's very exciting. I think you even have a video. And so, we've got this liquid gold, which is basically massaged into the skin. It goes down into the sebaceous glands. It's layered in there and then lasered in there with a phototoxic reaction or damage to the sebaceous glands that reduces the activity or density of the glands and their sebum production. And basically, it's like isotretinoin or Accutane, as people know, but without all the systemic side effects.
Got it. And there's some promising new devices as well. How do these work?
I think you see me massaging into the skin. That's the liquid gold. It's actually black because it absorbs all the pigment. So, some of the newer devices are, there's a new FDA cleared called AviClear, which is a laser that actually destroys the sebaceous glands. I still love my LED, and this is a home unit that my patients love. Both my kids have it, and you can wear it and do homework while you're working. It's low-level laser, again, to bring down the redness, kill bacteria, and it works really, really well. And there are other devices that are coming up on the market.
All right. I don't know. I might have to be careful with low-level lasers, doctor. We want to get to the topicals now. What new treatments are available on the prescription level?
Yeah, so this is a great one. This is called Winlevi, and it's a prescription, and it is basically a derivative of an anti-androgen called spironolactone, but there is no systemic absorption, so it doesn't actually affect the hormones. It does reduce sebaceous secretions and sebum production. There's also a new Seysara, which is an antibiotic that is actually very specific to the microbiome and targets basically the bacteria that cause acne, the main one. And then there's also new retinoids, which are new vehicles, so they're a lot less irritating than they used to be and can be used in ages 9 and up.
Wow, there are so many options out there. Dr. Ablon, thank you so much for your time and for your insight this morning. We appreciate it.
Of course. Thank you.
All right, so to learn more about Dr. Ablon and her practice at the Ablon Skin Institute and Research Center, you can check out their website. It is abloninstitute.com.